Thank you, Dr. Pakirtharan, and I hope you will be available for the discussion time. Now we open for the discussion, and we have 6 presenters. We have about nearly 20 minutes. I would like to take very few questions from the audience. Of course, there are 6 presenters, therefore at least we can have 2 questions for the each presenter. Now we will take the first presenter, Dr. Sandun Rajapaksa, and he made the presentation about the prevalence and factors associated with sexual dysfunction. I think I will start one question from the doctor and probably from the audience also, and my co-chair also can ask questions. And as you mentioned very clearly, in the first trimester, sexual dysfunction is significantly lower, isn't it? And the advanced, third trimester, it is much lower. Have you done anything about the controlling the parity in the sense that null parities and parity 1, parity 2, because, those who have gone to the higher parities, they have more experience about the situation. My question is basically, have you done anything controlling the parity matter? And also the other link question is that in medically or health conditions are concerned, there is advantage of sexual functions during the pregnancy for the delivery and other items are concerned. Probably you can come in quickly. Yeah.
For the first questions, I actually took the data about the parity. Then anyway, I divided into multiparous and primiparous. But then I tried to find the association, but there was no significant association between parity or having a sexual dysfunction. It is not only between primiparous or multiparous. And I did try to find the association between the advanced parities as well. There was no association. I thought there would be, but the second I didn't really get it. The question.
I think literature says that sexual activities during the pregnancy will support the delivery and other facilities later on. Is as a conclusive evidence for that from the Sri Lankan studies or elsewhere? Have you found any literature on that?
Of course, the women and men believe that having sexual activities during pregnancy will enhance their facilitate delivery. I could not find any related data, and also there are some evidence say that some chemicals in semen will dilate the birth passage cervix. So and many believe that, but I couldn't really.
Thank you. And is there any question for the anyone want to ask any question? We can ask at least one question from the Dr. Sandun. Anyone would like to ask?
Dr. Sandun, I saw that there is a high correlation with the education. So that do you have any suggestion that how we should actually concern, or whether you suggest that be included in this sexual education in the school curricula or something like that?
That is of course a big issue in Sri Lanka, but more than like incorporated into the school curriculum, we can take necessary action to deliver this information at public health level or Ministry of Medical Office of Health or antenatal clinic. So I have worked at Medical Office of Health. In some even midwives have no idea. They are clueless regarding sexual activity. So sometimes they give the advices not to have sex. So that is a big issue.
I think from the audience, we expect at least one question. Is unfair for the chairpersons to put questions every time. Is there any single question for our medical person? If it is not, I think since we don't have much time, I will move into the second presenter, Miss Tirani, and menstrual stigma and assessment of the Sri Lankan perspective with focus on individuals with advanced level and higher education in Sri Lanka. Any question from the audience again? Now again, I put a question to the Miss Tirani, and the question is actually in your study you have 2 samples. One is male sample, other one is a female sample. Usually menstrual stigma is largely related to the women. Probably men also feel something transferring from the women to men. But what is the real purpose of including a male sample there? That's a question number 1. And also, what is the marital duration? At the young, if their marital duration is quite shorter, the experiences are somewhat low. And also, I don't know whether you have any sort of idea that age at menarche, some sort of problems even before marriage, menstrual issues, and whether it is continuing after the marriage in a more serious manner or not. Therefore, my basic question is that have you touched upon anything before marriage part, and also why the particular male component is included? You may say that it's a couple, therefore male has been included, but is there any particular reason?
Thank you for the question. I didn't really take into consideration like relationships with men or marriage. So that's not why I included men, but because it's stigma and belief and percept. So those things, because they do apply to everyone, and because even like decisions that are taken at policy levels about reducing taxes on menstrual products or having like better sanitation facilities at schools for these reasons, there are men also coming. So I think those attitudes we have to take in their attitudes also. So that is why I consider them. But I do wish that I had more men, because there were only 28% in the sample. And no, I did not also consider married. So like whether or not the participants were married. About 88% of the participants were below the age of 40. So they were mostly young people. But yeah, I did not take that also into consideration.
Any question from the audience? Actually, we have about, I think, nearly 40, 50 people. Unfair for the chairpersons to ask the questions all the time.
I think that you have met regular as well as irregular cyclical people, right? In your study, do you have any categorically analysis on that? And even that you said that there is a qualitative part, but I didn't see that anything that in the conclusion.
Yes, in the qualitative interviews, so I interviewed 10 people and about 4 medical professionals. So did not talk about like irregular and regular periods, but then we did talk a lot about things like menarche celebrations. So those, I did not include it in the presentation, but yes, something that came out there was like most of the women remembered their menarche very vividly, like they could recall all the details, and they also found celebrations very embarrassing and sort of recall them in a negative. And that kind of like enriching that quantitative finding about like who approves of these celebrations. Yes.
Thank you then.
Thank you. Normally the stigma size in the menstruation. So do you find any literature or some insight from the findings? Sometimes they may stigmatize themselves, but not the society or in the school or workplace. There is no stigma, but themselves stigmatize. Oh, I am menstruated, so I am so stigmatize themselves, but not the workplace. So are there any such insight from your finding?
You mean like literature that says that participants, like the stigma comes from within but not from external sources? There was lit find that like a lot of female participants also hold these stigmatizing beliefs, but in general I think it is impacted by social attitudes and all that, right? Things you learn from your environment, from your childhood. So
Thank you. Then our third presenter was Ms. Kavesha Kumarasinghe, Family Planning Utilization Trends in Western Province, 2017 to 23. Is there any particular question you want to raise to her? Her study was basically family planning utilization in the Western Province. At least one can ask why he selected the Western Province. Now, I like to ask one simple question. Now, in Sri Lanka, of course, once you consider we have traditionally accepted these items are the family planning methods or contraceptive methods. But Sri Lanka, we know that usage of postino, emergency contraceptives are there, and also medical abortion is happening very significant level to avoid the pregnancy for the postino and to terminate the pregnancies with the medical abortion. And what was the real definition you have used for contraception here? Is only traditional and modern contraceptives basically we accepted because people tend to use some other methods outside the contraceptive level?
So we use the modern and traditional family planning method. So we just use the things we are like in the field level, we are using the method mix family planning method. So we use that things to do the study.
Never ask anything about any terminations, only the family planning or contraceptives.
Yeah.
Right.
One few questions. I didn't go through the abstract presentation. So this period is related to the COVID-19 pandemic. Did you see any differences, kind of types, contraceptive methods, type differences during the contraceptive, the usual before the COVID pandemic and then after the COVID pandemic? Are there any some changes?
Yeah, actually, we also wanted to see some differences in the COVID period other than the next before the COVID or after the COVID. But actually, we didn't see any differences between the COVID period. So it's the general thing in the modern or traditional family planning method. So we want to see some difference, but we didn't observe anything in the COVID period.
Do you think that there is no difference because of the high prevalence of contraceptive methods in the Western province? So, any analysis other province?
Yeah, I think we should do other analysis with the other provinces also. But we just do the research in the Western province. So yeah, we recommend to do the research in the other areas with the national level data also.
Yeah, in fact, it has been found with many studies that higher the education level, higher the use of traditional methods. Therefore, definitely Western province people tend to use traditional methods more than the other provinces because the education levels are much higher in the Western province. Our presenter is Mr. Coleman Tian, and his presentation was in-depth analysis of the diverse drivers of unintended pregnancies among adolescent girls and young women in Atlantic Department of Benin. Sorry, 1 minute here. The Kumudu Sumeda is there. You have to, exploring disabled male veterans subject to positioning and gender identity construction in sexually intimate relationship. Male veteran and their gender identity, intimate relationship. Any questions?
So the presenter mentioned about compensating relationships to bridge the gap between their physical disability. It's a compromise they make. Is it seen only in the severe disability, or is it seen in the other disabilities, normal disabilities as well?
Actually, it's seen within many impairments. Like it's not only severe impairments. Even for an example, one participant who is visually impaired. So we can compare to a participant who has multiple impairments. But even that person who has having visual impairments also gone through a compensatory relationship. So it's common. Thank you.
Any other question for the Dr. Kumudu Sumeda? Any other question?
It is not actually question, but actually I really enjoyed your presentation.
Thank you
Comment.
very much.
Thank
sir.
you.
Thank you, Professor.
Can we move into the other presenter that because we are running short of time? From the Benin in-depth analysis of the drivers of unintended pregnancies among adolescent girls. Mr. Coleman, he has made a presentation about why the young girls becoming pregnant and what are the reasons behind. And in fact, I have found, I can remember reading African literature that sugar daddy kind of concept that, young girls and, even we learned about that kind of, literature very much from the African continent. And you mentioned here that these girls are forced to support themselves of their families and also transsectional sexual relationships, not for the cash. What kind of items, transactional mean not the cash, but what kind of items these girls usually get, clothes or any food, or what kind of?
Thank you, Professor. I want to respond you in English, but my English is extraordinarily good. I beg your pardon to help me with my colleague Roger. I want to explain in French. C'est vrai ce que vous avez dit, que les filles et les femmes qui sont victimes de grossesses précoces ou de grossesses non désirées ne prennent pas que de l'argent, mais il y a certains avantages que les auteurs de ces grossesses-là leur montrent. On a constaté que c'est beaucoup plus les ouvriers qui aident les élèves, surtout à l'école, mais les femmes aussi qui n'ont pas de moyens, c'est beaucoup plus ces ouvriers qui enceintent ces filles-là et ces femmes-là. Et donc, les grossesses non désirées sont dues, dans un premier temps, aux moyens financiers dont les femmes ne disposent pas, mais dans un deuxième temps, à des contributions que ces hommes apportent à ces filles ou à ces femmes que ça soit sur le plan matériel, sur le plan, donc je l'ai dit, financier, mais également en termes d'apport psychologique quand elles sont dans des difficultés. Voilà ce que tu peux dire.
Thank you, Professor. I will translate for us. What he says is the transactional checks for women is that I will buy for you a clothes, or I can give you foods for women who don't have food for her and her baby or her girl. Like, and I can pay for you the school fees. So it's a lot of things that men can give to women and girl to have a sex with them.
And also probably this particular behavior may leads to terminations or abortions, and there may be a lot of maternal complications and even maternal deaths also happening very frequently. I think so.
Yeah.
Any questions from the audience? There's a one person raising hand, luckily from the audience this time.
Just want to know because I was in that area because with the ICRC, and because there is a huge influence from Burkina Faso, Togo, and Niger, and related to conflict. Actually, internal communal violence are there in Benin, and because I have seen the research conclusion, it says only talking about the socio-economic factors. How about conflict-related factors? Do you have any evidence on it?
Merci. En réalité, cette étude a été menée dans un des départements du Sud et au Sud, il n'y a pas de conflit actuellement. Il n'y a pas d'intervention des djihadistes au Sud. Les interventions, c'est beaucoup plus au Nord, dans des zones frontalières avec le Niger, avec le Togo et avec le Burkina Faso et une partie également avec le Nigeria. Mais pour répondre à sa question, pour voir est-ce que les déplacés qui quittent leur village pour d'autres villages étant donné qu'il y a des conflits dans ces zones, oui, on enregistre également des cas qui sont liés au viol parce que les djihadistes prennent de force les filles et les femmes et il peut en découler des grossesses non désirées. C'est vrai que nous, actuellement au Bénin, on ne connaît pas encore cette situation de façon trop dramatique, mais au niveau de l'association béninoise pour la promotion de la famille, qui est une association membre de l'IPPF, nous sommes en train de prendre des dispositions pour intervenir ou nous intervenons dans ces zones en stratégie avancée pour prendre en charge la santé sexuelle et reproductive de ces femmes et filles qui sont des déplacés des zones où il y a les conflits.
Okay, thank you. This study was made in the south of the Benin, but the situation that you mentioned is in the northern on Benin. But us in IPPF, who is a associate member of IPPF, we work in this area to face the situation because we don't know how it can be in the south. So we work and prevent this situation, and we work with mobile clinics to give to population mode of services who can help her to have services like a clinic service and psychology services.
Thank you, Mr. Colin, and the translator also. And then our final presenter is available online, Pagirthan, and he mentioned his studies about menstrual hygiene practices among ordinary level girl students in Kilinochchi, and he studied about the menstrual hygiene practices. And I want to ask very simple question from you that, as far as I remember, northern province districts like Kilinochchi, there is a significantly high proportion of female-headed households, and there are sizable number of male-headed households also. Very clearly that female-headed households income levels are significantly lower compared to the male-headed household. Therefore, have you seen any difference between these two? And also you said about 25,000 average income, and how it is differ from these two groups. Thank you.
Yeah. Compared to the male-headed, it is significantly mostly in Kilinochchi district, especially after the war, the conflict. Mostly they have lost their husband or father. So mostly they are the breadwinner. So mostly their income is very much low, and especially if there's any male-headed,
mostly they are affected by the war, so they don't have the proper income to compete. But anyhow, but most of the families are from the female breadwinners. But there's no much significant between these two groups compared to other districts, especially in Kilinochchi. Both male and females are slightly marginally differences, but not that much because their working opportunities and are very much low for them. So their earning capacity is also very much low. That's also reflected in our studies, and which going to be reflect in the near future reproductive health, especially if you say take the global wise, it is 1 in every 6 people having a subfertility. But recent studies conducted by Faculty of Medicine in Jaffna by Ram and all, they have proved in Jaffna district every one of 5 people are having a subfertility. So if you don't properly address these hygienic practices, future it's going to be the drastic drawback, and especially going to affect the subfertility issues, majorly going to affect it is especially in this part of the region of Sri Lanka.
Is there any question for? You can hear there are.
I actually have 2 questions. One question is, in your study, you said that almost all participants use a disposable sanitary napkin. But did you estimate whether any of the participants also intermittently use cloth? Because a lot of young girls, due to economic issues, use cloth at home, but will only use a pad when they go to school. And the second question is whether you investigated their knowledge or whether they know about other menstrual hygiene products like a tampon or a menstrual cup.
That is an interesting question actually. Most of the time that even the data collectors from the zonal education department were female, but students are very reluctant because of the social stigmatization. They were telling only that pads, and they are not aware about the latest these tampons and all that menstrual cup, and we have encouraged, but it's very much less, mostly pads, or either they were telling they don't want to reveal the truth because of the economic, they might use the clothes, but in the research we couldn't prove it because the data sets was like that. They were telling that they were comfortably using the pads even though they are economically very much low. So that is actually from our part of the study. Thank you.
One question from methodology side. You mentioned it, development officers has been collected the data. Are they from health ministry or the education ministry, government officers? Second part, was it a structured questionnaire or whether they are open-ended was there? You mentioned it already, the answer. A lot of them were female, or all female interviewers has been collected the data, or mix male and female, because it's for a learning purpose. What the best one? Thanks.
Actually, we trained the zonal education development officers. They were previously had the experience for such similar studies. So all of them were degree holders, but appointed as development officers. So their data collecting capacity is good, and they are actually appointed as a psychological counselors in the district of Kilinochchi. So they were capable to handle all these issues after training given by us, and there's no male staff used for because the sensitive issues and it is not the openest structured questionnaire we have used. And yes,
thank you.
You
have 92% of the students have access to the covered toilets at home, but still you say there are issues remain with privacy, sanitation, even at home. I can understand about the schools where they will not have enough facilities. But what about the home? Have you gone into the in-depth analysis?
Yeah, actually the data were collecting from the parents and the students participants. We didn't actually inquire about the actually whether it's covered or not. Actually we didn't, but we believe that they were telling the truth from the parents side, confirming. and we need to do the future studies in a transparent manner to exclude those kind of information. That is really important things, as you said. True.
Yeah. You said that the research setup is a school. So did you disseminate your results to the school authority, and what is their response to?
Still, we have given the zonal education department. They are happy to actually. They are very much happy. We are conducting this research through the Faculty of Medicine, Kalani and Jaffna, because they were giving full support. So a pilot study we have done in Jaffna. In the Savo Cherry. Then we have moved to the actual study center in Klinochi district. All of them were happy, but even though implementing these things, somewhat economical financial problems are there, but hopefully they will improve in the near future. We should improve altogether to have the good result in the future, because as I said, that the reproductive health of the children in the future going to be definitely it will affect the whole country. So definitely they are happy to incorporate the education and restructure all these recommended stuff through this study. Thank you.
Apologies, I think we are bombarding a lot of questions from you because I got the opportunity to listen to only you present. That's why I'm asking question. Okay, so it's a very interesting research, and I just want to clarify in the methodology you have mentioned within the Klinochi district there are around 82 schools, and your main target is girls. So have you considered out of 82 you have randomly select 20 schools, whether there are any mixed schools, boys and girls mixed schools, or you just consider only the girls schools?
No. We use the mixed school. Most of them are mixed school, and few of them are national schools. Where national schools also mixed schools. So there is very few schools are only the girls schools. So it is very difficult to isolate the girls schools like in Jaffna or in Western countries, not like Methodist or Visaga. But here it's mostly mixed one, so we have to go for the mixed.
Okay, thank you for that explanation. One more question, like among these mixed schools, have you considered the factor if they are a male or a boy in the school, whether that be a kind of a barrier for them to practice their hygienic research when it's come to menstruation cycle and their hygiene?
Yeah, actually it is interesting that we thought to include the male counterpart also, how they feel, how they comfortable with the female students. But our Kalani University, in my supervisor, they were said, okay, only go with the female students, no need to go because it's a sensitive, because they take long time. So because based on the time factor, we were only considering the female student. But actually, as you said, it is better to include the male students also. So it will be a collaborative and a synthesized study, how they feel and comfortable with the opposite sex. Thank you.